My name is Germano Pestelli. I am a medical doctor specialist in rehabilitation and I am working in Italy.
I'm Andrew Cole, Chief Medical Officer for Hammond Care, which is an independent Christian charity in New South Wales, Australia, and I'm a conjoint Associate Professor at the University of New South Wales.
I'm Dr. Mohammed Sakael. I'm the Director of Neuro Rehabilitation Service in Canterbury, United Kingdom. I graduated in Dhaka Medical College, Bangladesh.
Okay, I'm Carolina Capacasa. I come from Argentina. I work for ISPO as an organization, and I am head of the amputation service in the National Hospital in Argentina. And I also work for the San Martin University, teaching on the prosthetics and orthotics career.
Hello, I'm Fiona Stevenson. I'm a registered nurse from England working in Haiti.
I'm Mita Pierre. I'm a physiatrist. It means I'm a specialist in rehab medicine. Originally I am from India and arrived in USA in New York after I married.
My name is Michael Preby. I'm a physiatrist and currently I am studying public health at the University of Minnesota.
Hi, I'm Dr. Farooq Rathod, physiatrist from Pakistan. I come from Armed Forces Institute of Rehabilitation Medicine and I am affiliated to Pakistan Army, the Army Medical Corps.
Okay, my name is Leslie Al-Jashi and I'm from Saudi Arabia. I'm a rehab physician since 1998.
Hi, I'm Colleen O'Connell. I'm a rehabilitation doctor from Canada.
My name is Asari Christian. I'm from Ghana. I am a PGY2 resident at Johns Hopkins University studying physical medicine and rehabilitation.
Jim Gosney, medical doctor, Master of Public Health graduate, United States.
I am Dr. Taslimuddin. I am from Bangladesh. I am now working as Associate Professor of Physical Medicine and Rehabilitation in Bangabandhu Sheikh Mujib Medical University, Dhaka.
I'm Gail Buck. I'm a rehab nurse from Portland, Oregon, and I work in Haiti.
My name is Devendra Pia, and I'm the treasurer of the International Rehabilitation Forum.
The International Rehabilitation Forum gives an opportunity for collaboration and network among like-minded individuals around the globe, which really doesn't exist through the traditional academic or scientific specialty societies. We get to learn from each other and collaborate in areas where there may be gaps and needs with regards to facilitating rehabilitation program and education and care in under and low resource settings.
Years, Eugenio went from being totally dependent, totally lifeless, to having a full life.
She wouldn't even get to help herself in shower or toileting. She wouldn't make her bed. She wouldn't make herself a sandwich. And all she had more or less something congenital weakness of her hip muscles. Bedbound for the last 8 years. She wouldn't even get to help herself in shower or toileting. She wouldn't make her bed. She wouldn't make herself a sandwich. And guess what? After 18 months of a full rehab program, it was concentrated program, I have to say, because honestly she broke my heart. I mean, she was out of school, she's bedbound, she's such a young girl. Anyway, after 18 months, the mother came to my clinic bringing me a card. And what does the card say? It's her wedding invitation. And guess who is the inviting person? Me. I teared. Literally, I teared. She put me as the inviting host for her daughter's wedding. And what she said, you brought my daughter back.
For a lot of people, the disability has been seen as a curse. Whatever religion you're with, if it's voodoo or Catholicism, if you're a Baptist, Christian, whatever it is, the main thought was that if you were disabled in any way, you had wronged your God. So we're having to really try and change people's perception.
So the International Rehabilitation Forum has been very instrumental in helping people like me who wants to take rehabilitation back to low resource countries like Ghana. So what they have here is expertise who have done work in areas of low resource countries looking at the need for rehabilitation. They have come up with something that I think is also very important, is a collaboration that has resulted in a way to assess rehabilitation in low resource countries, which is a software developed by Dr. Haig called Language Independent Functional Evaluation. The problem we have in low resource countries, or in Africa in general, is the ability to measure function, and then the other issue we have there is there's so many different languages. So how do you actually measure disability? And one of the ways to do this effectively through the IRF has been the creation of this functional language independent evaluation, which is able to help us, give us a tool to scientifically or objectively assess the needs of people with disability.
In the areas where my organisation operates in rural settings, the hospital base is important, but it's often 30 or 50 or even 100 kilometres or 50 miles away from where the person actually lives. So we're developing community support services that develop care, and whose care is built around the provision of people who are basically trained care aides that are multitasking. The therapy costs that are running around $50 an hour. The point is that these care workers and these packages we can run for 90 Australian dollars a week.
We believe expatriates, people like us who have been trained in both Bangladesh and low resource countries as well as in developed Western countries, can contribute substantially in developing both British service as well as low resource services by learning from each other in various ways. There are ways to tap into that goodwill that we have and also have some understanding of the language, the culture and network and a sense of goodwill.
No, but by talking to people and by seeing what people do in different countries, you always enrich what you do and learn different things, different ways of doing the same things that maybe you do. I think everybody enriches a lot. It does not depend on the economical aspect of a country, but if you have a broad mind and you can get whatever they do in the different places, you always will be richer and you always will develop better rehabilitation.
This global passion of everybody is going to help to share the knowledge, share the experience of everybody, everywhere, to basically give the patients, and mainly disabled patients, to be functionally independent and continue to live quality of life.